lactation consultant, a certified professional counselor, and a licensed mental health practitioner. I'm certified in the field of perinatal mood disorders and focus much of my work on pregnant and new moms. The period of labor and childbirth is one of the most significant events in a woman's life. During this time, a woman faces her most intimate, emotional, and physical struggles. This is naturally a time of vulnerability, and as such, the events, actions, and treatment of those involved in her birthing process can have a profound impact on her psychological as well as physical well-being. When there are negative feelings surrounding the birth experience, it can be overwhelming. The feelings of betrayal by their care provider can linger, making it difficult to return for follow-up care, as well as making it extremely difficult to trust other healthcare providers. They are told time and time again they have a healthy baby and to just get over it. But the images, the thoughts, the feelings, the anxiety, the fear, the dread, and the regrets won't let them. It is a horrific event that fosters every part of their day, and they are reminded of every time they look at their baby. To define traumatic childbirth, we look towards Cheryl Beck, a leading researcher on the issue of birth trauma, who concluded, birth trauma lies in the eyes of the beholder. When a clinical diagnosis is needed, a therapist utilizes the Diagnostic and Statistical Manual of Mental Disorders, the DSM-4, criteria for post-traumatic stress disorder. This states that a person must have been exposed to a traumatic event in which both of the following have presented. The person experienced, witnessed, or was confronted with an event or events that have actual or threatened death or serious injury, a threat to the physical integrity of self or others, or the traumatic event also manifests itself including replays, dreams, flashbacks, and or avoidance of stimuli associated with the event. Triggers in birth trauma can be anything related to the birth itself. Location, care provider, the sound of medical supplies opening and the subsequent checkout, the clothes that were worn, smells, foods, etc. Feelings of disrespect in the childbirth process can also create feelings of traumatic birth. Penny Simkin conducted a study looking at the permanence of the birth story over time and found the women in her story were still angry and disappointed by what care providers had done to them 20 years later. Simkin found the way a woman is treated by professionals on whom she may depend determines largely how she feels about the experience for the rest of her life. Now that you have a basic understanding of what birth trauma is, how it happens, and why it matters, I'd like to address the two major reasons why this issue is important in regards to LB 428. Mothers who have a home birth with a qualified care provider are less likely to report experienced birth trauma. In an article entitled When a Bad Birth Haunts You, Dr. Pauline Slade described a major study of post-traumatic stress linked to birth. Dr. Slade says a woman's emotional state after a home birth tends to be very different. She is positive, self-confident, often exultant. Birth is something she has achieved rather than something that has been done to her. Afterwards, she can cuddle the baby in her own bed. A woman who controls the space in which she gives birth and who can therefore risk losing her self-control and can surrender to the overwhelming feelings welling up inside of her is much more likely to look back on the birth as a positive experience. Childbirth is an adventure in which she has discovered her inner strength, joy in her body, and growth in self-awareness and self-confidence. Birth is empowering. For women who have already experienced a traumatic childbirth and are preparing for a subsequent childbirth, allowing home birth to be a viable option is especially important. As mentioned earlier, these women are likely to have very strong feelings of distrust in their care providers and be very resistant to returning to a hospital environment. In a small study conducted by Beck and Watson, in which they explored subsequent childbirth after a previous birth trauma, they found these women were strongly motivated to make sure the birth was different this time. Nearly 1/4 of the women in this study opted to strive for a home birth. This is especially a high number when you reconcile that with only 1% of the general population is born outside the hospital. It's clear that while home birth isn't a desirable option for everyone, for women who experience a home birth are less likely to experience the very real traumatic effects of traumatic childbirth. Women who experience a traumatic childbirth are much more likely to have a healing experience after a subsequent birth that occurs at home. As a mental health professional and a woman's advocate, I implore you to please spend some time thinking about the growing population of women experiencing traumatic childbirth. Think of how these experiences shape them as a woman and a mother. Then please give the women of Nebraska an option to birth at home with a certified nurse midwife.
Thank you. Senator Cook, do you want to pursue your questions?
Perhaps
might be able to help me. Thank you, Madam Chair. Who may currently attend a home birth in the state of Nebraska?
Legally, nobody. There is no, as far as I know, somebody else might correct me later, but as far as I know, there is no statute that allows anybody to attend a home birth.
Okay. And the other inside-out version of that question, I think I got the beginning of an answer to that. So currently, a certified nurse midwife may attend a birth inside a hospital
Or a birth center.
or a birth center under the, what's the term?
Under a practice agreement with a physician.
Practice agreement with the physician, and this physician need not be present at the birth.
Correct.
Okay, thank you.
You're welcome.
Have you practiced in another state?
I have not.
Oh, okay. So it's mainly been in Nebraska that
Correct.
you have practiced? Okay.
That's all. I was just looking
no,
for somebody
no,
who might have
no.
practiced in another state.
So if I understand correctly, you are not a
I am not a certified nurse midwife. I'm a therapist.
You are a therapist. Have you worked with women who have experienced this traumatic birth, and have you counseled and seen what's happened in their experience when they've been able to choose a home birth in another state?
I have worked with women who have decided to choose a home birth in the state of Nebraska,
Despite the risks.
despite not having a certified nurse midwife to be their care provider. Absolutely.
Okay. Thank you. Our next